Well, thank you for staying with us on TMI. Let's get talking about our first discussion. This one has to do with health, in particular the COVID-19. The second wave has been here for a while now. We're now looking at where exactly we are with regards to vaccines and vaccination, for example. Then things like basic protocol, like social distancing, frequent hand washing, and wearing face masks, for example. But in between all of this, let's also look at, say, perception. What does the average Nigerian think today about the COVID-19 as against what it was a couple of months ago, especially in the course of 2020? I'm joined by Dr. Andrew Obi. He is the Incident Manager COVID-19 in Edo State. Dr. Andrew, good to have you on the program as usual.
Good morning. It's a pleasure being here today.
First, I want to say a big thank you, knowing that you're one of the busiest men I know right now, and you made out time to come, regardless of your busy schedule. We appreciate that.
Thank you very much.
But quickly, let's get right to it. I see more people wearing masks these days. I mean, you're wearing one, for example. They say, what was it called again? They say justice begins from the next door, and all that. But let's look at how that enforcement has always been a problem.
Yes.
Because it's one thing for you to put all the adverts on radio and television, on newspapers, and using the internet and so on and so forth. As it stands today, how well or otherwise are we doing with regards to enforcement?
You have just said it. But just to start by saying it's a pleasure being here, and consistently I've been on my marks anytime I come for this kind of interview to buttress the importance of this non-pharmaceutical intervention is very critical. And to also answer the other question you raised, is obvious. You just flash back to December before the Xmas and look at what is happening now. You would agree with me to a large extent. Compliance has improved significantly, and we must show sincere appreciation to His Excellency and for that initiative. For 10 months it has been appeal, and you know, one of the most difficult things to change in terms of health intervention is people's behavior. And but we are happy that through the leadership of His Excellency, we have put force to the messaging. So it's more like a subtle enforcement. And to a large extent, if you look through the streets of Benin, major streets, major location, marketplaces, banks, you see a lot of people wearing face. So it has improved significantly from the 1st of December now to where we are now. It's by over 50%, you know, improvement, and we are not stopping at that, because these are very important, you know, practices that will help protect each and every one of us.
Now, I want to talk to you about the impact of the second wave, because we've heard from experts like yourself who tell us the second wave is going to be deadlier than the first. Help us create that distinction.
Well, part of the issue is that, you know, when you have an outbreak, and in the process of the outbreak, from when you start having the explosive exponential rise in the daily number of cases, it gets to a point you peak and you plateau again. And at that point, you know, people's perception are like, oh, it's over. And if you recall, towards the end of last year, that was a general perception people had, that Corona don't go, is over with Corona. And so people let their guards down, and that is where the danger lies, you know. At that particular point in time when we thought it was all over, the numbers started rising again. We started hearing about imported cases, new variants, and we needed to do a lot of sensitization in terms of people taking responsibility. And so that is one of the greatest driving force for a second wave. Another very important point in terms of people's perception, behavior, and practices, another very important point to note is that when you're having a second phase or second wave of an outbreak, you already have established community transmission. Community transmission, it's, you know, the virus is there with us. Previously, we are thinking about imported cases. You can remember last year. It's not residential. Exactly. It is within, is established, and out of maybe 10 persons who come down with COVID, over 8 of them, you can't really tie it to a relationship with or direct contact with someone who might have been infected or have tested positive. So the risk is higher. And so these are very vital points that fuel and drive the spread. So you are dealing with a situation where you're having exponential rises in the number of cases. You have established community transmission, which which further increases the risk of everyone being able to contract that particular disease, and also people's behavior in terms of perception. It is not real. It is one of government. So all those, the cocktail together is what drives the rising number of cases. And that is why, you know, as a response, risk communication is very critical. We have been hamping on that. Information dissemination, engagements like this, you know, involving media stations, on the social media handle. But more importantly, as a response, we are engaging the grassroots, because not everyone that has access to social media. And so, as a response, we have intensified risk communication activities at the community level, at the rural areas. Because now, if you look at the spread is hitting more of those locations in Edo North and Edo Central, which you could term maybe they are rural or suburban.
At least for the most part.
For the most part. So you can imagine, and so we need to have a way of getting the right message to these people, and also to empower them to be able to take action, because now we must take responsibility.
In the course of the first wave, for example, we always heard about flattening the curve.
Okay.
Is that still an element in the conversation with the second wave?
You know, for every outbreak, the intention is to make sure sooner or later you get to flatten it.
Okay.
You know, flatten it in terms of containing the outbreak. And so it's just going to be a recurring decimal as in the numbers outbreak. We hope that this should be the last, but it's important to note that the way the entire thing is going, coronavirus has come to stay. And so we must learn as individuals to be able to live with coronavirus. And one of the very important things that we must do, not just as a state, which is having His Excellency as Hampton, is on strengthening the health system. We must strengthen our capacity to be able to identify cases.
I'm going to talk to you about capacity. I'm sorry I have to bump it on you. I'm going to talk to you about capacity in a bit, because at some point we need to link this with cancer. It turns out today is World Cancer Day. By the way, but globally, the narrative now centers essentially on two things: vaccines and vaccination. I mean, is Nigeria making progress on that front?
You say your two things, vaccines and vaccination. That's just one thing.
No, a lot of places will tell you it's one thing for you to have the vaccines, but going forward and vaccinating citizens is another layer to the conversation.
Exactly. It's important, you know, vaccination is at this stage. We need everything to make sure that people are kept safe.
Right.
We need everything that we can do as an institution, as government, to make sure we safeguard the health of our people. Also to reduce the risk or the level of severity or mortalities that could be associated with this. And so the role of the vaccine, very, very important. And quite a number of vaccines are already in use, outside the country. And now we are hoping that we'll get 100,000 doses for some targeted population, especially the health sector, which these are the frontliners. These are people who receive the first shot in terms of being able to address that. So those things are very important. But the other aspect that you talked about, the vaccine, getting the vaccines to the people. So it therefore means that the entire process, the entire gamut of the logistics, the planning process, must be well articulated in such a way that we would be able to achieve our goal and objective in terms of getting at least 60 to 80% of our population vaccinated within the shortest possible time. So this is very, very important. And so I believe strongly that vaccination is important. But also very important is our ability to take up the non-pharmaceutical interventions. That is also very important. How strong is our health system? You know, the entire vaccine conversation is quite expensive. And so we must plan it properly, because we are in a recession.
Right.
And so you have to look at it in a way, in a holistic manner, so it doesn't affect our economy negatively. Is it possible that we should focus our attention a little bit more on strengthening our health system? The entire health system. You see, COVID has provided an opportunity for us to have a rethink about our health system in this country and how we can improve on it. Because even after you get people vaccinated, what next? Can they access health care? How strong is our health system?
Going forward.
Moving forward. Is it possible that there could be another outbreak that would strengthen the global economy again? So you need to look at all these factors holistically and see how. So my attention, I think, should be more in the direction of strengthening our health system. All these gamuts of components are very important. To have the resources, make sure that the entire logistic process is well articulated, get our people vaccinated, but at the same time, they must take up non-pharmaceutical intervention. It's important to note that even at this stage, the 3 C's of COVID-19 prevention is very, very important. People must avoid close spaces, close contact, and crowded places. Those are places that provide a very huge opportunity for spread. Schools are reopening, the economy is reopening, and these are the emerging challenges. How do we cope with some of these challenges, okay? So that you don't just think just on the vaccine and forget the other part. They must work complementarily to protect our people.
I want to talk to you too about the resumption of schools, which just happened a couple of days back now. There were mixed reactions to the announcement of resumption right from December, as a matter of fact. But today is all behind us, schools are resumed. What are your sentiments really?
In terms of
whether or not schools should have resumed, because there was this strong argument against resumption of schools. I mean, I spoke with...
the entire thing at the state level, we're working, so most of our actions in the state, in Edo State, is data driven. We're looking at our statistics, we're looking at the risk, and we're also looking at the level of preparation and engagement. We needed to be sure, to a large extent, that the various educational institutions, cutting across the federal, state, and the local government, have been adequately retrained and their capacity built to be able to handle whatever situation that could arise in the course of reopening. Reopening schools means that you have more persons coming together. So those things needed to have been well articulated, and that's why we had that little delay. But now it's behind us, schools have reopened. Moving forward, we have task forces, which is a combined team from the Ministry of Education, Health, and the security pillar, that we are moving from school to school, ensuring that school heads comply with the basic requirements to ensure that they not only protect the health of the children, they also protect their own health. And by extension, their parents and grandparents that these children will come back to. So it's a holistic thing. It's not just the schools, the religious bodies, the traditional institution, the business sector, both public and private. Everyone must take responsibility for action, and that is where we are now. It's not just about government, it's about what we all can do as individuals to make sure that we are part of the story in terms of our war and fight against COVID-19. And so everyone must take responsibility for action, because your action or inaction could have direct or indirect implication on yourself, and by extension those loved ones around you. And besides, it's important for us to note as a state that in terms of the number of those people who are more affected in terms of mortalities, these are the aged ones, our parents and grandparents. And so we have more younger persons infected, more younger persons not having symptoms. That's when you're ill, you look at the whole thing and say, okay, I'm feeling unwell. But quite a number of people who have COVID, especially among the young persons, they don't feel unwell. And so those are the ones that fuel transmission. And so we are rejigging our messaging to make sure that these younger persons, and you would agree that most of this one falls under the student category, or those active work group category, they must take action. They must be responsible. They must wear their face masks. They must avoid crowded places. They must keep their hands clean. Okay? When we are able to do that, to a large extent, you reduce the risk of transmission and the effect on the older one. But it's also important to note that even in doing all these things, these young persons should be the change agents. They should drive the process. They should drive the process. You know, the internet has a lot of information on what people need to do. But taking that responsibility, as younger persons, we must take responsibility for our parents and younger ones.
You mentioned statistics just a while ago. I remember in 2015, for example, just when the MDGs were wrapping up, I spoke with you about a lot of the issues regarding the goals back then. Of course, we're just going to start the SDGs. And then you made a case, a very strong case at that time, for Nigeria to begin to inculcate more seriously the culture of using data to drive development, especially in the health sector. How much of advantage are we taking of data now as far as COVID-19 is concerned?
Like I said earlier on, most of our action in Edo State are data different. We work based on...
And that's just state-based, for example?
Yes, it's state-based. You know, you have to start somewhere. But generally, looking at developing countries, we know that data management and the use of data for action is something that remains a challenge, okay? And His Excellency is one person that is data-driven. And for Edo State, most of our actions, we use data to drive that process. Just to give you an idea a little bit of how data has helped us in terms of this entire response. As at the 30th of November, okay, after 8 months of, you know, response for the first wave, you know, for the later part of that month, we were not reporting new cases, and we had contained it. And when we looked at our data, we found out that over 95% of everyone who came down with COVID-19 in Edo State and reported early for treatment recovered. That was even before we started talking about, okay, when is the vaccine going to come or not?
Right.
Okay, and so we looked at that thing, and so at the earlier part of the response, when we didn't have a direction in terms of what is the true state of things in terms of the spread of COVID-19 in the Edo State, we looked at the entire process. Are we going to use modeling that are using figures that you may not be able to relate to your local domain? And so we said, okay, we must get ourselves involved in an aggressive approach to be able to identify the true state of things in Edo State. And we embarked on a screening of over 500,000 Edo people. And we felt that when we are able to do that, and you recall then you had the canopies, you had the mobile screen, the mindset was to get data for action. And we were able to achieve that. And in doing that, we were able to identify over, you know, as at that particular, over 6,000 confirmed cases in the States. Okay, so you can imagine. And based on that, we're able to now model and say, okay, how can we use this data to be able to project in terms of when we are going to peak, how we are going to coordinate our action? And we knew that to a large extent, if these numbers are coming up, we need to strengthen our surveillance framework. We need to be able to strengthen our case management capacity. Because if you have confirmed cases and you don't have a place to treat them, it's a wasted effort. So why are you embarking on it when you don't have? So that enables us to push the drive to set up treatment centers for at that particular point in time. But at the end of the first wave, we had 3 functional isolation facilities. The main one at Stella Obasanjo, UBTH, and Ira Specialist Teaching Hospital. As at the time we started the response, we knew that we needed to be able to identify confirmed cases. In the country alone, we only had 3 molecular reference laboratories. This was February, March last year. And His Excellency said that the only way we can be able to drive and contain this outbreak is to build our testing capacity. How can we know that someone has COVID? Strengthen the capacity of the laboratory. And in those states, as we speak, we have 4 molecular reference laboratories with a daily testing capacity of over 600 tests per day. So we're able to do, as we speak now, we have carried out in excess over 30,000 tests. In the first week, we carried out a total of 20,220 tests, and we have carried out over 10,500 tests between 1st of December and now. Why are we doing this? We need to have our local data to be able to drive action.
I want to ask you something now. I mean, still talking about action, really. The marketplaces, for instance, how well are we doing the marketplaces? I think churches are doing better. I mean, from what I see as a non-medical expert, churches probably are more organized in terms of the protocols, I mean, enforcing the protocols. But for the marketplaces, I mean, our markets for the most part are open market systems that we operate here. How much of challenge is that posing for healthcare workers?
Well, it's not just for the healthcare workers alone, but for the general populace. We have continuously engaged with the IECs and all the various market groups and unions, because we understand that that is a very, very good environment for spread.
Right. And
to a large extent, we have gotten consistent buying in terms of, if you go to the market, it used to be worse than what you have now. And so that has also formed a target group, a target audience that we need to be able to focus on, you know. And so we are doing everything possible to make sure that that particular setup, we have more buying in terms of the preventive measures that they need to take up, especially in relation to the use of face masks.
Okay.
So I think it's an area that we'll need to re-emphasize continuously and get their continual buy-in in terms of what they need to do. I
told myself I was not going to take more than 25 minutes of your time this morning. But just last question, 2 minutes before we're done. The UICC, that is the Union for International Cancer Care, now says that COVID-19 has increased risk for cancer patients, because it says that across the world, generally, COVID-19 has continually put pressure on healthcare systems. Of course, we know what the healthcare system is like back at home, for example. People have already started talking about the possibility of other outbreaks beyond COVID-19, whether first or second wave, for example. What are we in for, really?
Yeah, you see, if you look at our data, and one of the main reasons they are hamping on that is the fact that non-communicable diseases like cancers, talk about the major target organ is the respiratory system,
Right.
especially in relation to respiratory cancers. So most non-communicable diseases, not just the cancers, hypertension, diabetes, when you have that coexisting with COVID, and especially among the aged population, is like a bloody cocktail in terms of the outcome. Most times people don't survive, and that is why we are hamping on early detection. People must learn to come out willingly. As soon as you have any symptoms suggestive of COVID, fever, difficulty in breathing, you're having loss of sense of smell or taste, whatever those symptoms are, we know they are non-specific. Think of COVID first. Because we have found that, like I told you, in terms of Edo State, out of every 10 persons who present early, 9 of them will survive. So you have a higher likelihood to survive.
So the earlier the better?
The earlier the better. So the message, sir, is early presentation, early detection.
Okay.
And that is what we are doing in Edo State. Thank you very
Dr.
much.
Andrew B. is the incident manager, COVID-19 incident manager in Edo State. Thank you so much for these insights you've come to share with us.
It's a pleasure. Thank you very much.
Coming right up, I'll be talking with an economist and a statistician about the issue of poverty in Nigeria and what the numbers are saying. Stay with me.